Hello, my name is Lynette Espinosa, and today I'll be presenting on two programs. Before I begin the presentation, I want to briefly describe my dream position, which is to be an administrator for a Title I campus or an administrator for an alternative education program campus. I will now share my screen. The two programs I will be presenting on are pre-kindergarten and early childhood. First off, a goal in mind. The goal is to offer students of all demographics and identities at an early age the initiation of academic success with the introduction to educational programs that will focus on developmental growth in all aspects. Programs and curriculum will service students according to their unique needs to structure a learning foundation at an early age bracket to ensure students are performing at their grade level for the school years to come. Who is served by the program? For early childhood, children 0 to 3 years old, which are also toddlers and infants, and any children 0 to 3 years old that may be English language learners, children who have special needs, disabilities, or developmental delays in the 0 to 3 age bracket, and students who are 0 to 3 years old that have established conditions such as Down syndrome, blindness, or visual impairments, or hearing loss. For pre-kindergarten, the students that are served are children who are 4 to 5 years old and who are English language learners and children with disabilities and IEP or in the process of evaluation for a disability or an IEP plan. Now, the students need to qualify for the programs. And for early childhood, a child may qualify to enter early childhood if he or she is referred by a parent or other interested party that may advocate for a child who may be reflecting a disability. And children who do not speak English, which are known as the ELL students, they will also qualify for early childhood. There are some schools that will go ahead and accept children that are not dealing with a disability or that are coded as an ELL student. For pre-kindergarten, all students of all identities are accepted to pre-kindergarten, but the Texas Kindergarten Entry Assessment System is administered to develop and validate a kindergarten entry assessment that can better inform kindergarten teachers about the children in their classes, helping them to design differentiated instruction to meet students' needs and share information with families. What teachers and staff or members are there to help coordinate and support these programs? For early childhood, that can include early childhood teachers, early childhood special education teachers, paraprofessionals, administrators, special speech or language therapists, and occupational or physical therapists. As for pre-kindergarten, very similar to early childhood, the following individuals are involved: teachers, paraprofessionals, administrators, special education teachers, special education staff, allied health professionals, speech and language pathologists, occupational and physical therapists, orientation and mobility specialists for children with visual impairments, and behavior specialists. What types of curriculum interventions and instructional approaches might be applicable to the student population? For early childhood, the programs will focus on the domains of children development to include physical, social, emotional, and cognitive. As for pre-kindergarten, the curriculum interventions or instruction may include social and emotional development, language and communication, reading, writing, math, science, social studies, fine arts, physical development, technology, small group instruction, individual learning, and IEP students may be provided with therapeutic services, recommended adaptations, and instructional strategies. Bilingual programs are also enforced to serve English language learners. So children are able to be competent in listening, speaking, reading, and writing the English language. Now, how are these programs monitored and evaluated? For early childhood, the students are mostly monitored and they are evaluated by tracking developmental milestones, tracking cognitive and physical delays, formative assessments that are guided by the state or the district or campus, continuous student progress monitoring. Children may be evaluated for an IEP or already have an IEP, and there's existing short-term and long-term goals which are continuously reviewed. And so for pre-kindergarten, there are some informal assessments which include ongoing observations of work and play, systematic observations, reflections, anecdotal notes, checklists, which could be behavior and skills, portfolios, formal assessments that include screening measures, which can include any type of skill, progress monitoring measures, measures of what children are learning and rates of improvement. We can also have diagnostic assessments, which are in-depth analysis that are to detect underlying conditions and disabilities. For IEP students, they are evaluated through, once again, some established short and long-term goals, and the Texas Kindergarten Entry Assessment is used to determine if students meet specified academic standards and development levels. Now, some remedies and mistakes that we can go ahead and avoid For early childhood, we can definitely make sure to implement multiple instructional models for students' unique needs. Be responsive to individuals' needs. Be observant. Be very observant. Be vigilant of your students. Now, do not over-identify and place a student in a over-restrictive environment. That's a mistake that we can avoid. Resources will be misused, and the goal is for students to be part of the mainstream classroom as much as possible. For pre-kindergarten, we need to avoid the lack of properly planning a lesson. Do not overlook an IEP for a student. When you're crafting a lesson, make sure you take into consideration the students that are on an IEP plan. That way you know how to work the lesson properly. And please avoid having poor class management. That will hinder an organized environment, and children need structure and routine. They need to know and learn how to take responsibility. So if there are no more questions, this ends my presentation. At the end of the presentation, you will see some references that will go ahead and guide you with any further questions or topics on these programs. Thank you.